Good morning, fellow councillors. My name is Jill Taylor and I am the chair of the People and Health Scrutiny Committee. Welcome, welcome to this meeting. Welcome councillors, welcome officers, and also any members of the public who are watching in this morning. If I can start by just going down through the committee, because we have a huge number of people here, and just ask them very briefly to introduce themselves. Could I ask, I'll go down the list, could I ask Councillor Rennie?
Hello, I'm Molly Rennie. I'm the Vice Chairman of the committee and I represent Dorset East.
Councillor Adkins?
Good morning, Chair. Rod Adkins, representing Ferndown South.
Councillor Dunseith?
Good morning, Chair. I'm Jean Dunseith and I'm representing Chickerell.
Councillor Gorringe?
Morning, Chairman. I represent St Leonard's and St Ives.
Councillor Ireland? Councillor Ireland?
I'm not sure he's joined the meeting, Chairman.
Sorry, let me just sort my phone out. Sorry about that. Councillor Robin Legg? Councillor Legg here? Okay. Councillor Orrell?
Thank you. Yes, so I'm Councillor Orrell for Melcombe Regis.
Thank you. Councillor Penfold, I think we have an apology from her, but just in case she is here. Okay, thank you. And Councillor Pipe. Okay, thank you very much. There are 6 members here, so we are quorate. Could I just ask if Councillor Bartlett is in on the meeting this morning as the counterpart to the next scrutiny committee?
I am, Madam Chairman.
Thank you very much, Councillor Bartlett. Just a few announcements before we start the meeting. Could I just ask you to keep your cameras off and your microphones off unless you're speaking, because it really does help the meeting. As you saw, my phone has just rang, which I do apologise for. I can't do anything about that because it's next to my computer. Could I also remind members that this is almost a 2-part meeting. This is People and Health Scrutiny. At the rise of this meeting, or at 11:30, there will be a following meeting by Resources and Place Scrutiny Committee. So what I am quite keen for this committee is that we don't stray over into what should be taken at the other committee, but I will give more information on that as we go through. If I can just ask about the protocol for the chat bar this morning as well. It is slightly different. I would like anybody who wants to speak to put RTS into the chat bar, but I would like to try and keep topics together. So when you put RTS in, could you also add what part you would like to speak on? And then I can keep things compartmentalized so we're not bouncing around all over the place. At the end of this meeting, we will be producing a list of questions that we have for Cabinet, which will be forwarded on to Cabinet. Could we go to apologies, please?
Chairman, we only have one apology, and that's Councillor Mary Penfold.
Okay, thank you very much. Do we have any declarations of interest, please? Right, there is a silence out there, so I'm going to assume there are no declarations of interest. Should anybody wish to do an additional declaration of interest during the meeting, please feel free to come in. Next, we have public participation. We have no questions or statements submitted at the moment. Could you just confirm that, please, Helen?
That's correct, Chairman.
Okay, thank you very much. So we're on to the main, or actually the only agenda item for this meeting this morning, which is the budget scrutiny. First of all, I would like to thank officers for the huge amount of work that they have done on the budget this year. We've all had the option of coming to the cafes, the budget cafes, to listen to how the budget has been shaped and what the thoughts are from officers. We've also had additional meetings for myself as the chair and also for this committee earlier this week, just to give us some sort of clarity as to how we actually take budget scrutiny forward. My experience, I have long experience on scrutiny, is that budget scrutiny is probably the hardest thing we ever do, but it's also the most important. And I think I'm quite heartened by the amount of work that officers have put in this year to make sure that we have all the information and the knowledge that we need to be able to take this forward. As I've said earlier, there are 2 scrutiny committee meetings this morning. This is the first one. In an ideal world, I think we would have had a joint scrutiny committee, but it's quite difficult to do that within the Constitution at the moment. So hopefully by next year we should be able to have got that sorted, which would make this far smoother. What I will, can I just point out that on the screen we've got the, oh sorry, we are right. Can I just add on this that I think what we will do for this committee, we will concentrate on the 2 areas that cover this scrutiny committee. So we will largely be looking at adult services and children's services. The majority of the first part of this paper will therefore be dealt with by the next scrutiny committee. So what I would ask members to do is to either keep your questions for the next meeting, and if you're unable to attend that one, please tell me your questions and I can take them forward because I shall be staying for the next meeting. Having said that, there will possibly be information within that we may like to question, so I'm not for 1 minute suggesting that we don't question any of that, of the first part of this paper. I think it's going to be an interesting meeting, and I think what we need to do as members is to look very carefully at what we're doing. We need to think about whether the split of the funding across the areas is right. You will see that funding has moved from some budgets into others. Is this right? Is it sufficient? Is it too much? Is a question. But you'll also see that there are a lot of uncertainties within the budget. So I think one really good question we could ask ourselves is, if there is flexibility, if there is a little bit more funding around, what would we want to spend it on? Where would we want to direct it? And I think those are really key questions. If we can come back with something from this committee along those sort of lines, that would be really good. I think how we're going to do it this morning is that I've got 2 presentations, one from Vivian Broadhurst and one from Teresa Levy. I've asked for very short presentations because I want most of the committee, most of the time spent on this committee to be put over to our discussion. So I'm going to ask for a speaker first. What I'm then going to do is to open the floor up to any other members who are not committee members to ask questions initially, and then I'm going to confine it down to the committee for discussion. So if I can hand over initially to Vivian Broadhurst for her presentation on adult and house-based issues, please. Thank you.
Thank you, Chair, and good morning, everybody. I do apologise if we suddenly get interrupted, as it appears I'm about to have some oil delivered, so really poor timing, so I do apologise. I'm just going to take sort of 5 or so minutes to set the scene, and then any questions that you have, myself and my team, are ready to answer those. And if we need to provide any extra information as a result of the questions, we can do that also offline. So before you, you'll see the Directorate's financial pressures as set out in the paper. Just to set the scene, the majority of people that contact adult social care and housing do so at the point of crisis. We provide critical services to all the residents of Dorset, and mostly at the point of the most challenging point in their lives, when they're probably at their absolute most vulnerable. Prior to COVID, our services across the Directorate were facing increasing demand and greater complexity. The impact of COVID has really seen this demand increase at greater pace. This is making it even more challenging for us to keep pace and safe within the resources we have available. In a normal year, adult social care support approximately 4,000 people. This year, we expect to support 4,500 to 5,000 is our best guess at the moment, as we're seeing coming through. 28% of our residents are over 85, 18% is the national average. So this is an added area of pressure for Dorset. In housing, we are seeing presented for us 405 presenting as homeless this year. We've got 286 people in temporary accommodation, and at present we've got up to 90 people in B&B. So increasing safeguarding, increasing domestic abuse and carer breakdown has all been happening over the last period, which is significantly increased since COVID. The demand we are seeing alongside financial pressures, such as increasing costs, complexity and COVID, is a significant pressure, as I've said, for the Directorate. In this year, we're forecasting 14 million overspend. In 21-22, that pressure is 14.9 million, of which the Directorate, in terms of savings, is looking at saving 8.8 million through tactical and transformational savings. This is a very challenging position for us. The majority of our budget is spent on care for individuals. In 2021, the proposed budget is currently 128.6 million. 102 of that budget is directly spent on care costs. Across the country, adult social care has been facing huge pressures, as you'll all know, and it continues to face pressures given COVID and given the increasing pressures on the NHS, at the same time as funding to adult social care, as we know, for the last 10 years has been reducing. Housing faces funding issues and temporary accommodation and increasing demand issues. Adult social care budgets are needs-led. We can't easily predict the cost, and we can't easily predict the demands we face. A young adult with complex needs can easily cost us 100,000 a year. The COVID epidemic has exacerbated our demand, pressures and financial impact. And this has really been highlighted across all of our families, all older people, working age adults, and people with living with mental health conditions and our unpaid carers. We have 6 provider homes that have notified us that they are closing. Sadly, we have seen 90 confirmed COVID-related deaths in care homes since March. The financial pressures and impacts that we are facing over the next 15 months, these are unknown to us at present due to the long tail of COVID that you'll all be, very aware of and hearing in the news. It's a complex picture. We've got rising unemployment, evictions, long-term health conditions, and more complex health conditions that people are living longer with, which is a really good news story, but that means increased costs and support needed. For example, the number of over 85s receiving support has increased from 1,300 to 1,500 in the past 12 months. So what are we doing about it? Our Better Life programme is underway, and we will look about how we reduce demand. by supporting people better at the front door, better information, advice and guidance, expanding the use of technology and building community resilience, and we will be better able to support our residents earlier with a clear intervention model and a prevention lens. Our transformation is undertaking 1,900 reviews. They're strength-based reviews. 42% of people for whom we provide services to at present, which involves taking each individual family through a very, very careful and person-centred review to recognise their strengths that they have and build on that. However, this is a complex process, as you can imagine, particularly if that individual does not have capacity. Each review takes a substantial amount of time. We aim to review these 1,900 people, and we aim to support people to move in the right accommodation, moving out of long-term care facilities into the more appropriate and better placed extra care supported living schemes, which enables people and is the right thing to do to live independently. Working with health to ensure that we've got appropriate funding streams and the appropriate care for people is really important and has to be a focus of how we work. The flow of patients from the acute and community hospitals has really impacted on adult social care. The shorter stays mean that patients are being discharged earlier because of COVID and higher levels of short-term needs. This means that rehabilitation and reablement service are blocked, and creating a long tail for people who normally would have benefited from reablement and rehab and being able to return to their own home, either with no care or less care. As we're moving on from emergency housing arrangements and help people move into B&B to more stable arrangements, this also is the right thing to do in our transformation, but creates a pressure. Finally, as adult social care and housing are facing continued challenging times, as is everybody else, we will continue to provide critical services for our residents at some of the most challenging points in their lives. We're focused on sustainable housing, strong and healthy communities, and helping people stay independent, safe and well. We want to focus our attention on those people that need us most and have the most complex needs. With our strength-based approach, talented workforce, co-production approach with our providers, our housing associations, our health partners and our voluntary community and wider sector partners, we're in a strong place to meet these challenges. But there is no getting away from the fact that this won't be easy, and this is the most challenging of years for adult social care. So that's the background of which we're working. You've got you have the details of our programme of transformation. We're very happy to answer the individual questions that you may have on the budget lines or any further conversation that members would like to have. Thank you, Chair.
Chairman, it's Helen. Just to say that Councillor Robin Legg is having some IT issues at the moment, but he hopes to join us shortly.
Okay, thank you very much, Helen. Thank you very much for that, Vivian. That was really, really useful. I think one thing I would like to just point out in the papers is that you will note that the social care precept is being set at 3% this year, which is going to help with the issues that Vivian has talked about. So we may want to think whether we're happy with that and content with that. But at the moment, I've got one RTS in the chat bar from one of the committee members. Are there any non-committee members who would like to comment at this stage? I've got Councillor Miller. Can I bring you in, please? I will come back to you, Councillor Gorringe.
Thank you, Chair. I'm grateful. I just really wanted to back up and add to what Vivian has said. She's clearly outlined the challenges we face and why it's really important for us to go into our budget as confident as we can, because actually adult social care is not, we're here today to talk about the money, but it's not just about the money. You know, it enables people, it transforms lives, it supports us to work and be independent. And actually, when you think about what your money actually pays for, it doesn't go as far as you might think. And just to give you some examples, £7.5 million from the budget. If you look at what that actually buys you, that will buy you bed-based nursing care for 36 of our most frail Dorset residents, nearly all of whom will be over 80, and half of those will be living with dementia. It will buy you 216 older people to be helped to get washed and dressed and fed in their own homes. And it will buy you 36 younger people with a learning disability to live in a community, in their own community in Dorset. It doesn't buy you those huge numbers that you might think. And I wanted to stress that those individual costs really are significant. And we have to make sure that we use this budget setting process to set a realistic budget for adult social care. We need to have clarity on the potential pressures, as Vivian's outlined at the start of the year. And if there are any additional funds that we can find through the setting process and in the year ahead, then I think it would be really positive if that can be used to help support the pressures that we've got in adult social care, because this is really shaping the care that we want for ourselves and for our own families for the years to come. It's about everybody. So thank you, Chair. I just wanted to add that in.
Okay, so thank you very much, Councillor Miller. Could I now go to Councillor Gorringe, please?
Thank you, Chairman. There is a lot of risks in this budget, which really does concern me. This is really for Vivian. We got 6 provider homes that are closing. I'd like a little bit more information on that, if I could, please. And I'm also very concerned about the 13 to 15,000 people, over 85 residents that are over 85 that are needing support, and I can see that increasing. I'm also concerned about, as I say, about the savings that we're looking at to make in the adult area, and I just can't see it happening. So I need convincing that this is going to happen, that we are going to make savings, but there are a great deal of risks here. Thank you, Chairman.
So thank you very much for the question. It is correct that there is a great deal of risk in the budget as we see before us. I think in terms of, so to take your last question first, if I may, in the transformation budget, in the transformation approach, I think we are confident we've got absolutely the right approach, and we need to do this transformation. No doubt about that. That it's the right thing to do. That we need to better able to support people earlier with that prevention lens, so that we aren't getting people coming to our front door too early without good information. So we really need to help people better to understand what they can do for themselves, where else they can get support. How do we keep people healthy and well? How do we have that approach that means that people get the immediate support straight off to, say, an acute event that enables them to have reablement and support that gets them back on their feet and enables them to live independently without anything to do with social care, because nobody wants to have services, you know, that's in nobody's interest. But we do have you know, a significant over 85 population. And you know, that, as I said, you know, it's 28% higher than the national average in Dorset, which is you know, significant for us. So the more that we can do to ensure that we keep people healthy and well throughout the early stages of their lives, and as they get older and they get the right interventions at the right time and able to get that in their own communities with community health support, is the way that we will be able to better support people when they really need us at that really significant end of their lives, when they are needing more complex care. So it is about reducing the flow of people so we can concentrate on those most complex people. So that's how we and everywhere else is focusing the right support in the right place at the right time, and we're doing that across our providers and are working with health in that area. On the homes closures, of 6 home closures nationally, we are seeing a significant amount of homes closing. We do have some in Dorset. Some of those are the right things to be doing as we reposition what's needed in our communities. We are supporting our homes to be in the right places at the right time. In terms of geographically availability, has to be thought through, and also we've got to get the right type of care for people. And in some places across the across Dorset, you know, we've got too many homes that are providing not the right care at the right time. I can see that Tony wants to come in terms of, you know, giving a commissioning view in terms of what that means in terms of my and his responsibility to ensure stability in the market, whilst we ensure we've also got the right types of care for our residents. So I'd just if it's okay, Chair, if we could probably pick that point up with Tony now, he could give that further detail.
Yep, thank you. If we can go over to Tony Meadows, I do see that Councillor Tuker's got a question on care homes, so I'll be taking that one next.
Thank you, Chair. Just as a matter of introduction, Tony Meadows, I'm the Acting Corporate Director for Adult Social Care Commissioning at Dorset. I think firstly, in terms of the care home closures, the 6, it's very important that we're clear on not all of these are closing or have closed due to financial reasons. Some of these, it's a choice of the organisation where they've made a business choice. And in some cases, it's actually been regarding poor quality, where we've supported with CQC the closure of homes because they weren't actually delivering the right level of care for our residents. So it's important to get that context. Some of this is not COVID related. Some of it is, some of the pressures are. But even before COVID, we had more care home beds, residential beds, than our actual requirement in the Dorset area. We were oversubscribed, and some of that actually is an opportunity in terms of how we work as a council in the future to control that through our local planning, etc. So I think there's a lot of opportunity to manage some of that. I think the other side of it is, when I'm talking about utilisation, we were seeing a travel, I suppose, in the population where we were seeing about a 4% to 6% reduction year on year in the demand for residential places. And that's not just with council placements, that's not just relating to savings, that's also within self-funders. People were choosing not to go into care homes more and more until the last moment, when their own situations were so acute, their own complexities were so hard or high that they needed that level of care. So things are changing. And I think this gives us an opportunity, as has already been stated, to really look strategically at ensuring we've got the right care homes doing the right type of care in the right places to support the communities of Dorset. And I think we're in a really good place to be able to move that forward. And that is a really key part of our transformation plan that we're working with providers on.
Thank you very much, Tony. That is really useful. Could I now go to Councillor Tuke and just see whether that has answered your question, or whether you would like to ask further questions on residential care?
Thank you, Chair. It did to an extent. It's a significant saving that's in Appendix 1 on fewer people going into residential and nursing care, 3.7 million. I'd just like to understand a little bit more about the basis for the assumptions behind it, and Tony's addressed some of those, but for such a significant saving, I think we need a little bit more detail as to what the basis for that assessment is. If Tony could perhaps just address that a little bit further, I'd be very grateful. Thank you.
By all means, Councillor Tuke, happy to take that, Chair.
If I can just come back in, because Councillor Rennie is asking to talk about money. Is this also to do with care homes, Councillor Rennie?
No. No.
No. Okay. Thank you very much. If I can now go to Tony to answer on the savings around care homes, please.
Okay, thank you. So just to be clear, I mean, the savings in terms of the figure mentioned, 3.7, it's not purely around care homes. There's a number of different factors in terms of how we provide care differently and how we make sure it's the right care at the right time. So that is not just around the care home budget. And in terms of breaking that down a little bit further, we've got a whole transformation plan, which each one of those budget lines doesn't truly represent. So again, I think there's some information that may be in the appendices, but it's definitely something that we can provide to you to give you further assurance. In terms of the care home element, what we're not saying is people will not have residential care or nursing care when they need it. What we're saying in reality is there has been, and this is a national situation, I suppose a tradition or a history of actually placing people sometimes in care before they actually need it. And that's why nationally we've seen things such as the Home First programme. And it's really how we can actually ensure that we get people home, but sometimes it might mean intermediate care. So that little bit of help, maybe some rehabilitation, some reablement that might be in a residential setting before they return home. Because at the moment, what we're doing is we're actually assessing people's need, or what we have been doing is assessing their need at the point of crisis quite often when they're in a hospital. Now, they're already in a situation where they've become dependent on a lot of support in that environment, and they've not really got moving yet. They've not really maximised their full independence. And a lot of the work we need to do needs to refocus that around actually supporting people to be as well as they can, and then, if possible, getting them back home or to other forms of accommodation that may support them. But we do know that residential care and nursing care can sometimes be a move for people that can start to take away some of their independence. And, you know, the outcomes are good in terms of when you've got that high need and you're maybe at the end of life, or you're in that need of that really constant 24-hour care. But we also know that actually in a community, in your own home, with your own front door and the right support around people, and that's for us, not just as a local authority, that's the system as well. That's the integrated care system, us and health partners and community. We know we can give better outcomes to people.
That is really useful. Has that answered your question, Councillor?
To a degree, I think so. Would I be right in assuming that some of this saving in residential and nursing care will also lead to the proposed increase in the adult care packages, or is that solely down to the because you're trading one off against the other from the sound of it?
To a certain extent, there is an element of trade-off. It's not a total trade-off. What we're talking about is obviously the right care in the right place. There is obviously a need for, or there will be an increase in people requiring the right support at home. So yes, the demand in terms of home care will increase, but also what we're wanting to do, or what I'm wanting to do, and we as a directorate want to do, is actually work with providers. And traditionally, when we look at home care, it's been very much coming in and providing that care for the person at that point, and it's an ongoing service mentality. We want to bring in a culture where actually all the way through everything we do, we try to, yes, provide the right care, but we're actually re-abling people to be the best, the most independent and maximise their ability and, you know, deliver those outcomes. And I think fundamentally there's the element where that investment is really, really important, because what you won't necessarily see is a flat line, which we've seen in the past. I think the other side of it that we're not picking up on is actually the prevention element, which comes into other parts of our approach. So actually getting in sooner, actually finding those points of contact with communities, with people, where we're providing that help before people hit a crisis, because that is always going to be the thing that really triggers, you know, some of these more expensive interventions, is really, really key. And how we move to a place where we're working more proactively in the community and working with people and focusing some resources as a system in that direction is really, really essential to solving the problem. And that is really part of our transformation plan.
Okay, thank you very much, Tony.
We've also had a comment in the chat bar from Jill Vickers about offering people personal budgets to support them, to employ local support, which does not carry with it the same levels of overheads, which might be useful. Okay.
Okay, thank you.
Okay, thank you very much. If I can now go to Councillor Rennie for her question. She was next.
Thank you very much. It is about money. I was thinking for when we debate the subject later, and maybe we're not going to be able to have Vivian to explain this. And Laura spoke about how much it costs to buy certain items off the menu. And I'm wondering if we are getting support financially from elsewhere. Tony's talked about Home First, and if we're taking people out of hospital sooner, that's releasing the care on the NHS. And I'm wondering if there's ever any external funding that comes to us that we know that we can add in to the money we get for social care, or are these, because of course the needs are going to be greater, and have these discussions been going on already with the outside providers who are our partners within this scrutiny committee as well?
Can I ask for somebody to respond to that, please?
I'm happy to respond, if that's okay, Chair.
Yes, Tony. Yes, please do.
I mean, as Councillor Rennie has highlighted, you know, a lot of the things we're talking about aren't just a local authority responsibility. It is about a broader system. Getting people home first, we agree, is absolutely the right thing. But you are quite right that people are being sort of supported to return home a lot earlier in their journey, in their recovery. I think it's fair to say that, you know, we're in an early stage of actually developing and landing some of this. It is right that obviously the whole system, the system isn't just about health partners, it's also around community, etc. That we use all opportunities to ensure that funding is maximised to support people, support the residents of Dorset. I think in terms of the conversations around how that's done, we are looking at how we're working with our health partners. We are looking at the Home First programme as a specific, because of what we've got at the moment is an interim solution to see us through the winter. So we are working with those partners very much in the background to ensure that we have the right system with the right funding to support things, and obviously ensuring that each partner is sharing proportionately the risk element around that funding. So in essence, you know, it is about making sure the right care's there. It's not just around community care in its traditional sense, because again, there's some services that would have traditionally been provided in hospital that aren't in the community, and it's ensuring those are actually making that impact on that person's life in the community now, so that that person can be enabled to be as independent as possible. So yes, I can assure you the conversations are taking place. Obviously, everybody is very conscious of the financial situation that all organisations are in at the moment, but we are working on a very regular basis with our partners to ensure that we're trying to address some of those equities in finance, etc. I don't know, Vivian, you'd like to come in on a little bit further?
And just to say, you know, we are having conversations with our health partners throughout the COVID process and pre-COVID around the fair price for care, and ensuring that we are having those conversations which are about making sure that we are acting in legally in our adult social care responsibilities, because we cannot be seen to provide a clinical intervention or support a clinical intervention. So it's really important that we have that fair balance of health and social care funding, and that we have a review of the funding that we are getting at present. So we are in conversations with our CCG colleagues around the costs of the joint health budgets, the areas of continuing healthcare, and the fair share approach that we want to have in terms of people coming out of mental health hospitals, coming out of long stay hospitals, and those people that have significant and complex health needs. So we are in negotiations around that. We are talking with our CCG, And it is very difficult because our health colleagues' budgets are under pressure at the same time as ours. But there is a need for that re-looking and reviewing and rebalancing what we pay for and what we're getting at the moment as a local authority. And part of that conversation, is a joint conversation with the CCG across both ourselves and the two councils, as we share the same CCG. And it's really important that we get the right funding for our residents, because of course, as you're well aware, that we charge for adult social care, and care provided by our health colleagues is free. Is free at the point of access. So we need to make sure, both legally and morally, that the right people are getting the right care from the right providers. So our job in adult social care is to have those really clear conversations with our CCG colleagues and get those refreshed and renewed agreements in place.
Thank you very much, and that was really helpful to see that the Better Care Fund arrangements and the 5.3%. Of course, and I think within the scrutiny role, we've got to make sure that this risk is managed. And it's really been useful to hear this from yourself, Vivian and Tony, because the other members because we're going to have to be careful. We're going to be asked to make savings. That's always the norm, and if there's any bonuses coming our way, well, that's fabulous as well. And we are aware of the transformation is not just for us, it's for everybody as well, all the other service providers who are having problems with their budget. So it's useful for us as members to be aware of that and the risk. Thank you very much.
Thank you. Can I, I'm going to take the chairman's prerogative now and jump in with a question related to this as well. I'm well aware that an awful lot of care in the community is done. Sorry, an awful lot of care in the community is done by volunteers, by relatives, and there's often a case that a lot of the burden of care is put back onto relatives, etc., and friends and community groups. What are we doing to support them and making sure that they're not going under at a time like this, please?
So I think we have all seen that incredible shift and change during COVID. That our communities have really supported people well, and really been invigorated to get involved. I mean, what we've also seen, of course, is an increase in our informal carers coming to us, being, after being in very difficult circumstances during the period of lockdown, most recently coming to us at a point of crisis, and really requiring very intensive support from us. So we're really the resilience in the community and working together with people about what people need is really important. You'll have heard us talk about the need to have in place a different conversation with our communities and our residents. So we've talked quite a lot in other forum about the need for a Dorset deal, about making sure that we are supporting our communities to do the right thing, and they are enabled to do the right thing earlier, and that we help build some of that resilience, which could mean a small group in the community, which we've seen really fantastic acorns flourish as a result of COVID. But our job is to support that, to get that in place, to build that resilience, at the same time as being able to respond to when people are saying we need help, that we have got the budget to be able to do that in the right way, that enables us to intervene early enough that we can then respond to people and put in place some care and support that may be only episodic, that may just take, you know, a small intervention that really supports a carer to carry on caring, and, you know, that we put people in touch in the right way with other people that are also caring. But if people do need care, and they are providing, you know, really complex support to people, then we're able to do that. But that means that we absolutely have to shift the balance of the care that we've got at the moment in place, because at the moment what's happening is we are spending the majority of our budget on people coming and having packages of care, when what we are endeavouring to do during our transformation journey is get that early intervention and prevention much tighter and much clearer, so that we can free up some of that budget to move to those people that need it in the best way possible. You're on mute, Jill.
Jill?
Sorry about that. That is really useful. Thank you very much, Vivian. Tony Meadows is asking to come in on voluntary organisations and carers, please.
I just wanted to make a point which is quite an ironic one to make in a budget scrutiny, but I'm going to go there. As a commissioner, my role isn't just around spending money. It's actually about being a catalyst to bring things together, and I think we've got an opportunity to work with communities different. So it's acknowledging that this is part of our transformation as well. So as we get improved data and information, that enables us to work with small groups, with the community sector, the voluntary sector, to actually be able to enable them to actually understand, shall we say, demands slightly differently, and put cases together for external funds just about we provide in terms of finance. And I think, you know, understanding those challenges, and we're in a much better place, actually enables us to perhaps support some of those groups and some of those communities in a completely different way to how we have in the past. And again, how we develop that partnership, and it is a partnership, how we develop that and support it isn't always around what we can fund, it's how we can support and what we can add in kind and work with to try and deliver those outcomes. So it's just really the assurance that what we want to try and do is work with those communities and build things.
That is really useful and very assuring. Thank you so much, Tony. As somebody who was working quite hard during COVID, the obvious need is there for our community to have this sort of support. If I can now go to Councillor Ezard, please, for her question on funding. Councillor Ezard, are you there?
Myself, which doesn't want to. Here we are. Can you hear me now?
Yes.
Yes. You can't see me very well. Yes, several things that have been covered, actually, that Vivian's covered. Just to say that the awareness for carers, it is an onus on us to actually give carers, family carers even, a review. They should have a review of what they're doing, so they feel that they are cared for themselves. But also I noticed that Laura sent out an email to all of the members, so was it yesterday or the day before, saying who to, you know, get in touch with, and you know, signposting people that needed help and care, especially carers. So I really thank her for that, because during this winter there's a lot of people that especially contact us members. But actually what I wanted to say was that really, when people come out of hospital, it's so important to have all of the groups, a wraparound you know, service that is actually consistent throughout Dorset. I have said time and time and again, you get one GP surgery or one next door to the other, and it's like being you know, a postcode lottery. They're so different. They act differently, and so people ring me up and say, well, "What do I do? You know, how do I handle this?" I said, "Which surgery are you with?" So that's where I start from, because they're sent out of hospital with a note saying, "Go and see your surgery." And that's it. So it's not enough, and you do need this wraparound. And remember, we have got lots of people like Admiral nurses, Macmillan nurses, Marie Curie nurses, in the sort of voluntary sector area that can be called on. And certainly during COVID myself, I managed to get a Macmillan nurse for an elderly couple that were really independent and didn't want too much help. But I said, look, I think that you do have to accept that. And actually that works very well. So we ought to be using a lot more of these services. Hospitals use them, but I don't think that Dorset Council use them. The other thing is about digital help. We need to introduce more and more about digital monitoring and ensuring, you know, like when people need to take tablets and things like that, instead of somebody visiting, that we put in place a sort of monitor that actually checks up on people and also their movements, especially dementia patients, so undependent people that live in their own homes, all those sorts of things. So I think initially it's quite expensive, but actually long term it would pay off. Now, can I ask Vivian, that is that something that is coming along? Is it a work stream that we're working up on the digi side? Thank you.
So,
Vivian, for
thank you, Chair. So just to reiterate the conversation we had just a little bit earlier when Tony was talking, and that I picked up in the opening, is that the Home First approach is very, very much around getting the right wraparound support for people that have an acute episode, either needing an acute hospital admission or an acute episode at home that can be managed in their own home with the right health and care support. So the Home First model, which is a system, so it's our integrated care system that work together with our primary care networks to make sure that we've got the right health and care support to enable people either to not go to hospital in the first place, or to spend as little time as possible in the acute settings and be back at home, and we can support those better. But we do need that real shift across the whole system to enable us to be able to have the right support in people's homes. So as a integrated system, that's what we're working on. In Dorset, you know, it's a very, very brand new approach to Home First. In other places, it's been well established. I think what has happened during COVID, that's really been accelerated. You know, what then needs to happen and sit behind that is, how do we work together to move some of those monies around to ensure that we are able to fund at a very local level. You know, as you were saying about the GPs, the different experiences that, you know, I know my colleagues in the CCG and the primary care networks are really wanting to establish that Home First wraparound support. But you know, that is a challenge, to move monies from, you know, it takes moving monies from an acute position into our primary care focused community and community health. So we are engaged heavily in that conversation, and it's a really important conversation as a system. We can't do that on our own as the local authority, but we can push hard with our system colleagues to make sure we get that in place. And we've got a real commitment from the system, but you know, the money has to follow the people. On digital, I would absolutely say all of our transformation programs that we are looking at is absolutely focused on putting small interventions into people's homes so they can be supported, be it in their own home or be that in a care home even, or in supported living, that they can manage much easier without without the intervention of a carer or support. And for some people, that's absolutely their preference. So as with all of us, we all use different sort of digital devices to help us manage our homes. We're seeing care homes and some of our own facilities really embracing the digital offer and making sure we've got smarter homes to ensure that people's health and care needs can be managed. So in our health side, you know, we have got in place really positive bits of digital kit to enable people to manage their own medication, take their own blood pressure, to be able to give readout to GPs, you know, and that's really accelerated during COVID because of not being able to have face-to-face. In adult social care, you know, that's our absolute drive, is to see technology as a real enabler and a real provider of people's independence. So it's not in some cases, in the most complex cases, you can still use digital as a complementary offer to care, because you know, nobody wants an enormous amount of care coming into their own home if they can manage it through digital devices that complement the care that's available. So it's an absolute passion and drive of our transformation program that we get that in place. And then there's the front end of our service, which is much more about making sure we've got the right self-service available for people that want to know how they can help themselves, where to go for certain bits of kit, and how can they have the right information. So we're using the digital platforms on you know, across the piece, really, from very complex interventions to enabling people to self-serve and manage their own care.
That is really useful. Thank you very much. Is that okay, Councillor Azard?
Yes, absolutely. Thank you so much.
Okay. Yeah. At the moment, I haven't got any more questions, but I do understand that Councillor Robin Legg has now joined the meeting. He's been having IT problems. And if I could just ask, I'm also having problems with communicating with my vice chair at the moment. I can see messages coming in, but I can't actually find them.
If you want, I'm afraid I can't say Jill, anything very sensible. I've been listening to what's been said. Well, no, sorry, I haven't been listening to what's been said. Let me rephrase that. I've had 45 minutes of talking heads, but no sound. So that's a problem, and IT tell me that it's a problem with Windows 10 software, which may explain why we last night had a number of people who weren't able to do recorded votes, because I had the same problem getting sound last night. Mind you, I would think some of the members would probably have been quite grateful if I'd been locked out of the meeting altogether last night.
Thank you very much, Councillor Legg. I think we've had quite a long and quite in-depth discussion about adult services.
Sorry, Jill, before you leave, you've got John Arrell wants to talk about residential homes and budgets.
Okay, sorry, could I go to Councillor Orrell, please?
Thank you, Chair, and thank you to the officers for their reports. I'm going to agree with their plans. I mean, we have to, really. We've got to do the best we can within the resources that are made available to us. And I do acknowledge that over the last few years, the integrated care between health and social services has been quite revolutionary. Thinking of how, particularly in our area, Westhaven Hospital and a team that goes out from there, have a much better model than we used to have. So the overall thrust is good. I do struggle to see how we're going to make these millions of savings from care homes, though, without actually some people being denied care. My experience, I do recognise that, say, 10, 15 years ago, people used to go into care homes too early. My observations these days is most people only go into care homes at the last minute, and a lot of people when they're in the final days of life now. So cutting some of that care will actually be, people won't be looked after as well, but we have no choice, really. These are the budgets we're set. looking at 12.4. Looks like we've lost 77 million over the last few years. We're doing our best by integrated care and keep it, but we shouldn't fool ourselves that this isn't a cut. And we should still, as a council, while we do our best to still be lobbying for decent funding for social care, as set out in the Dilnot report. So we should make the best of it. We should integrate, and I won't oppose any of that, but we should also flag up that this is a cut, and we need more money for social care and a better settlement nationally. That's it.
Thank you very much, Councillor Orrell. I've got Tony Meadows asking to respond.
Thank you, Chair. Obviously, in terms of the settlement for social care, and that's a significant issue, obviously, on the political agenda. I think in terms of our proposals, I just need to put a bit of context on. At the moment, we've got in excess of 400 vacancies across residential and nursing care beds in the Dorset area. It's higher than it's been for a long, long time. But that has been a trend prior to COVID as well. What we have to recognise is this isn't just around, shall we say, people that we support at our front door to access care homes. What we do face in Dorset is self-funders that may choose to move and may choose to go into a care home prematurely and fund it themselves. And we don't find out about them until possibly, 12 months, 18 months, when they have potentially utilised up resources and their own funding, and they become then eligible. And that can be quite a cost pressure for us from that point of view. I think what we're really saying is, fundamentally, if somebody needs to be in a residential or nursing home, that is our responsibility to ensure that that happens. And in some cases, to be perfectly honest, we also have to recognise that giving the right outcome to the person may mean that in some situations, some home care may actually be the equivalent cost of a residential placement. So yes, there's a lot of work for us to do, and we've got to manage how we do that through. But we are not losing sight of the positive outcomes that we need to be delivering for the residents of Dorset.
Thank you very much. If I can go to Vivian now.
Just to conclude, because I know, Chair, that you need to move on. But I think to yes, it's a challenge. Yes, it will mean changes for some people. I think we've got to remember that some of what we are looking at is we haven't got the best outcomes for people as we are at the moment, and to give a bit of context as well, we are seeing that we need to do this transformation regardless of the budget pressures. It's the right thing to do. So yes, this is a very volatile budget. Yes, it's got risks attached to it, but we also need to be improving the outcomes for our residents, be those older people or be there younger people coming through. And what, just to give you an example, that, for a younger person that we've been recently working with that came through our transitions programme, they had a placement that was at high cost. And, this is not unusual, 3,000 plus a week. And with a lot of careful and skilled work, what we've been able to do with the family, the individual and all partners is that we've been able to reduce that by £1,000 a week and actually move that person into having their own home with the use of lots of assisted technology and some care, but given them more independence. So yes, this is really difficult. Yes, it's volatile. Yes, it's very challenging, but also we are seeing some significant reductions in some care packages, and they are the right things to do because it's improving people's outcomes.
Thank you very much, Vivian. I think just to conclude this part of the meeting, what I'd like to add is that people in health scrutiny have got the Home First model and the integrated care well and truly on their agenda for the forthcoming year. We have it on the January meeting, and it's also scheduled for the April meeting, because this is where the risks are around what this council is doing at the moment with adult care. Thank you very much, Vivian, and thank you very much, Tony. If I can now move on to our second presentation, which is with Teresa, please. Thank you.
Thank you, Chair. I do have a presentation, so I'm just going to try and see if I can share that, if I may.
Thank you.
I've pressed my sharing button here, sorry. If not, I'll just... Hopefully members are seeing that.
Yes.
Yes, great, thank you. Okay, that's great, thank you very much. So, gosh, what a year it's been, hey? And the reality is, I think, as we all appreciate, it's very difficult at the present time to determine just what the implications of COVID-19 will be on our society generally and on our communities, and I think particularly upon our children and their experiences. What we do know is that every community and every aspect of children's services has been affected, but that experience does vary greatly, and I'm an absolute advocate of looking towards the optimism for our children and hoping that this will, in the end, I've frequently said, I'm hoping that for many of our children, 2020 will in the end simply be a bumpy and grumpy year where they've had a bit of a difficult time, they may have lost a bit of capacity in schooling, and they may have had some more challenges around social integration, but beyond that it won't have life-changing impact, but for some it certainly will. And for some it has been exceedingly difficult and traumatic. And that complexity of experience is one that we need to hold very close as we look into next year and try to work through just what that's going to mean for our communities. But actually, unfortunately, COVID happened at a time for children's services in particular, where there had been significant increases in complexity and abuse levels and difficulties, even pre the pandemic. What we know nationally for ourselves and for locally is that there has been significant increase in the risks, particularly for tiny babies, particularly for families who previously wouldn't have been known to us. So we have seen an increase in child protection. And when we look at that level of increase in child protection, that is very often around families that wouldn't have been worked with us previously. So it's important that we work differently with those families, that we intervene effectively, see it as a short-term crisis, hopefully, that we can work to maintain those children returning to their families where possible. But some of the incidents, some of the injuries have been very serious nationally and locally. Nationally, they are talking about a 30% increase in child deaths having been reported to the national body, and many of those being co-sleeping deaths where there's an association with domestic abuse. So we have got a significant event going on across the country about the worst possible outcomes for so many of our children. And for us locally, some of those worst outcomes have been around the areas of complex mental health and leading to an increase in youth suicide. And tragically, that certainly has been a situation that our staff and our communities have been facing and working with. County Lines, as always, transforms at pace. If only people put that innovation to good use, wouldn't it be a great thing? But the reality is they innovate and they change and adapt to whatever's happening, and it hasn't slowed down in any way during COVID, but it's gone through different routes. The use of the dark web, the use of drugs and other things coming through people's front doors, and other complex ways in which young people have become at risk from some of that drug dealing, and those county lines working throughout our county. We have a really good grip on what those are and how those are. As I say, they transform at pace. But I would want to absolutely balance that with that some of our children and families have actually benefited from living in a different way, found the lack of the hustle and bustle something that's been positive for them, and some children in care homes in particular, in foster homes in particular, have actually nuzzled down nicely with their families and taken a real time to get that bond in place, and it's worked very beneficially. This is a 7-year report that the Association of Directors of Children's Services produce each year, and this is this year's draft first copy. It's a quite terrifying picture, I'm afraid, as you look across the level of increase in demand in the last 12 years, and clearly 2020 has only made things more difficult as you see those increases going up and up and up. From our perspective, we know very well where we are. We know ourselves very clearly about where we need to pay attention, and we've been doing all of that and delivering our transformation programme through this year. So there are three significant challenging areas for us, and these are our three priorities. So our quality of practice must be consistent everywhere. We see really great examples of good practice, but we also see practice that continues to need to improve. And we can talk about large-scale transformation projects which we have got in train, but fundamentally, basic good consistent practice across the board, led by basic good management, is what will improve outcomes and drive down spend. It's the hard lines work that needs to be done alongside the significant transformation, and we have got really good and strong strengthening services plans in place to do that. And we do that best when we have permanent staff, and so we have been working relentlessly on ensuring that we can point to our key social work posts in particular and our key management posts. And we've had a good deal of success on that, and are looking forward to a new year where we're almost to full permanent capacity, which has been an incredible piece of work by members of the team across the whole partnership of One Team Dorset. So our remaining challenge, and I think the challenge that we face every day as senior leaders, is the sufficiency of placements. We simply don't have enough placements locally or nationally to meet the needs of the children in our care. It's well rehearsed on a national stage that the care review, which is overdue and stalled at the present time, is absolutely urgently required. Across the whole country, the leader of Ofsted, Yvette Stanley, announced last week that she was very clearly aware there wasn't enough foster carers, no matter how much good work people have been doing around further recruitment, and that there was a huge concern about the level of residential provision for children, both in terms of the capacity and therefore the ability to match well, but also in terms of the quality of care. And we have really significant concerns about that. Consequently and subsequently, there has been a long history in Dorset of using expensive unregistered provision. Unregistered provision is never cheaper than registered provision. It's never a saving, it's a simple not having enough provision where we need it. And we're working to eliminate all of that use by the end of the year here in Dorset. And therefore there will be a change in spend patterns. We still have currently insufficient in-house foster carers. We will be looking at a range of options for transformation around that in terms of how we deliver better support, so best recruiters of foster carers or other foster carers. We absolutely have got a clear plan with our partners and others working to recruit carers with us, and we certainly haven't seen the loss that others have during COVID, but we do experience the challenges of many of our foster carers being older and shielding and self-isolating to protect themselves and their families. So we've got a range of transformation bids to build provision. Those are all in train. Lots of agreement, and lots of our plans passing through planning committee last month. Thank you. And we're really looking to the new year to see some real delivery of those properties and those premises and those homes coming online for our children. And in doing that, we will be able to cease the use of expensive, unregistered, and have more of our children living in Dorset, where we will be able to change the spend pattern too. So we've undertaken the transformation of our service delivery model, that blueprint for change piece, which was to eradicate gap and help us to intervene earlier, now called our Dorset Children Thrive model. And we have our existing and new managers who are fully supported to embed that consistency of practice. We're developing the Edge of Care approach with the Harbour. It's based on North Yorkshire, who have been a fantastic support to us through the Partners in Practice programme from the DFE, and that will launch in the spring of 2021, although there's already work going on with the outreach team now, and we'll be able to review that with the Loughborough University and evidence base around that impact. Really great engagement with our partners, 2 PCSOs already identified to join the team, and health colleagues looking at how they can support with the kind of health roles that we need in that sort of approach too. As I've said, we're continuing that focus on improving quality of practice. That's what we need to be talking about all of next year. It's where we need to be absolutely confident that all of our practice is good and that our strengthening services plan is delivering that. So we do expect to be good by the end of next year. That's really important for us as a Children's Services Department. You know that we are relentlessly inspected by Ofsted and others, including the Children's Commissioner, and we've got a really confident plan and a transformation programme that will see the sufficiency of placements will be well underway. There's a big risk for us in terms of Ofsted. It's a key indicator for being able to get a good judgment. And at the moment we're in a requires improvement place with that, and we need to move that on at pace. A poor Ofsted costs a lot of money, and we're really clear that that's not where we want to be. We want to be able to focus on the strengthening of practice, sure which are both under pressure, are managed tightly. We've got to stabilise the senior leadership team. We've had a recent SEND inspection from Ofsted. That was very positive feedback, and they've also given us some good feedback on our Dorset Children Thrive model. Thank you. Just stop sharing. So fundamentally, good outcomes deliver a balanced budget for children's services, but we are in a place where at the present time we have not yet enough information on what the impact of COVID is going to be. You can see the pressures that are in the budget for this year and the proposed pressures, which are slightly lower for next year, but they are almost all related to placement costs. We have been unable to move some children through the system during COVID, where we've been in court with children and their families. The court has quite understandably said that this is not ordinary time for families to be assessed, and therefore we've had a slowing down of being able to outcome those children. But we are beginning to see the actual numbers of children stabilising, and if we'd been able to exit children to permanent placements in the way that we'd have normally been able to do, we would see a significant drop. We will, however, continue to see those children with us in terms of our care leaver status, and we've invested in that and to make sure that we have enough care leaver capacity to support those people as they leave us at 18. So our requirements for next year are supported and underpinned by a significant savings programme too. We've looked at every single line. Clearly we'd already undertaken a zero budget build of our staffing structure with the Blueprint for Change piece, and within that limited our level of management and looked to invest in early help and frontline practice. We will this year make sure that we review our present children's centre delivery to update that model to fit the family hub model that government are next year. And broadly what that means is that any of our community offers will be looking to deliver to a broader age group of 0 to 25 and be fully integrated with our Children Thrive. But that may well mean that we leave some buildings and we move into other buildings, and that's where we're seeing some of those changes come from. I'm very happy to take any questions, Jill. I'm very aware that time's short, so I'll stop there if I may.
Thank you very much. Teresa, I think, oh, that's it, okay. At the moment, I haven't got any questions in the chat bar, no RTSs. I think the one question I would like to ask is that you've put an increase into the budget for external placements. I'm just wondering about the resilience of that. How accurate do you think that is? Because it's so very, very difficult to predict these sort of things going into the future. And I'm just wondering about the methodology you've used for that, and whether you think this is going to be sustainable at that rate, or whether you're going to be coming back at some time and asking for more.
Thank you, Chair. So we've looked in detail. It shouldn't be the case that children come into care from having not been known and worked with us in other parts of our system. Increasingly, we want children to be known to us very well. We want them to have been on a child protection plan, potentially in pre-proceedings work, so we will be able to know exactly who becomes looked after. Now, of course, there are the occasional cases that come out of the woodwork, either because they're new to us geographically, they've moved into the area, or they're new to us because they're babies, or you know, a situation has occurred. But fundamentally, we should be able to know which children are going to be coming into our care, and we've profiled the requirement on that intelligence. But you're absolutely right. If one of those unknowns is a family of 6 or 7, that is a substantial, into the millions, package that's required at pace. What I would say is we've had some lovely success in the last few weeks placing sibling groups of 3 for adoption together, and we've had some really good feedback from some adopters coming forward who want to adopt families of 4 and 5. which is fantastic. So you know, we need to be able to continue to do more of that in order to get to the right space. But what we have in our family at the moment are a lot of older children, not because they're coming into care older, because we're holding that very tightly, but because they've been with us a long time. And so those children will be with us, and increasingly we're sensitively reviewing their plans, and where they are a long way from home, we're looking to try and bring them home. But that needs to be done very thoughtfully at a very child level basis, and we'll do that over the next 2 to 3 years really for many of our children.
Okay, thank you very much. That is really useful and assuring. Can I now go to Councillor Weller, who's got a question on early years?
Thank you very much, Chairman. Really, I wanted to highlight this at this meeting, although it is something that I spoke to Teresa about at Corporate Parents as well, and it is that we all acknowledge how important early years are, and the early intervention work will ultimately save us money later on. And my concern to flag up to committee members here is the review of supporting qualifications and training for early years. This is a sector that's being squeezed horribly. We know their margins are really, really tight, and I wouldn't want to see that because of lack of help and support from us, that training wasn't occurring at that stage, or wasn't occurring so well. So whilst I acknowledge and understand that we do have to make savings, I'd really like us to see if we can find some imaginative ways of making sure that that qualification support still occurs. Thank you very much, Chair.
Thank you. Teresa, would you like to answer?
Thank you, Councillor Weller, and it is one of our savings targets that we have under review at the present time. It actually is a small amount of top up that's paid to people to support them paying those levels of qualified staff. Now, it does need review. It needs to be fair, it needs to be transparent, and it needs to be part of an overarching piece that I absolutely agree about how we support our early years providers. And it may well be as part of the just signed off the great sufficiency piece of work undertaken by colleagues, we will be looking to say, where do we need to provide that support, where is it absolutely essential, and wrap that into that. So yeah, we will, as I've declared before, it's an absolute firm belief of mine that having good and outstanding early years provision is exceptionally important, and particularly we're reviewing all of our early years provision around the need to have good outstanding provision for our SEND children, because it's absolutely essential. But you're right, Councillor Weller, many of them are under difficult financial circumstances, and we need to support all of them fairly and transparently where there's that greatest need. So we will review it, but absolutely take into consideration the message you've given.
Thank you very much. Thank you, Chair. As I say, I wanted to flag it to other committee members as well, so thank you very much.
Thank you very much, Councillor Weller, and also for your response, Teresa. It's interesting that at the moment on the forward plan for people and health scrutiny, we've got very little around children. And I was actually talking to the Vice Chair yesterday about what would be appropriate to put on, and we were discussing the early years programme, maybe the most important, because if we can get that right, it will save money going into the future.
That's very welcome.
If I can come now to Councillor Rowe, please, on IAG, and I'm terribly sorry, I don't know what IAG is. I should do, but I don't.
Good morning. My question is about IAG, information, advice and guidance, and the review. Teenagers will need support like never before. And as I'm sure everybody's aware, that unemployment affects mental health, self-esteem, and the longer a young person's not engaged in education, employment or training, the more difficult it is for them to move forward and flourish. I just really wanted to know how you think a review will impact on NEET young people, so not in education, employment or training? And also, how many currently are NEET in Dorset? Thank you.
Thank you, Councillor Rowe. And Chair, if I might, I'll ask Claire Shields to talk about the commissioning of that particular arrangement.
Yes, please.
Good morning, everybody. I'm Claire Shields. I'm the Corporate Director of Commissioning, Quality and Partnerships in Children's Services. Yeah, absolutely. Really focusing our efforts around information, advice and guidance on what we're required to do, and using our investment in a different way. So we know there's been a lot of policy changes to how careers education is delivered, with the responsibility moving very much from the local authority to schools, and schools are doing a great job of getting up and running and provide that careers education. The review that we want to do is very much focusing on those who might become NEET, who are more at risk, and working together with our colleagues that are all in the localities to better identify and support and wrap around those to prevent them to become NEET, but also to invest in engagement programmes. And beyond careers advice, what the young people that are disengaged need is a different type of support. So the review is very much about moving the responsibilities to career advice where they should be, which is with the schools, and invest in our work on the re-engagement work and working alongside our colleagues in the lab and others. I haven't got the actual number of the NEETs off the top of my head, but I can get it for you. We have seen a slight increase as a result of COVID, but we're alongside and working with all of those young people to try and find them some opportunities. So work for us to do around a range of opportunities post-16, about how we can think about apprenticeships in different ways and different routes for those young people. But absolutely, that's what our focus will be going forward.
But it's really good. Good. Does that answer your question, Councillor Rowe?
Yeah, it does. It's of great concern to me, because I think young people are going to really struggle going forward. And I think it's a good plan to look at the at-risk young people. And I agree, they do need a different kind of support, absolutely. Otherwise, they just won't engage. So thank you for that.
Okay, I've got no more RTS in the chat bar, so I'm assuming there's nobody else wishing to talk. So I think you've got off quite lightly, Teresa, compared with Vivian.
I did, thank you.
If I can just sum up and come back to the recommendations, if the recommendations could just go onto the screen, please, that would be very useful. Thank you very much. Most of the recommendations, as you'll see for this meeting, are about noting and testing and challenging the assumptions. I think where we go to from here is on item 6, which is where we put our comments forward to Cabinet, which will work out. I mean, I've got a huge amount of notes about the questions that have been asked, which have been incredibly wide-ranging and really, really useful this morning. I think the thing for me that I'm very heartened to hear is about how much of our agenda is around prevention, because when budgets are really tight, the easiest thing to quite often cut is prevention, because it's almost unseen. It's the hardest thing to measure, but I've noticed that both across adult services and children's services, it's about prevention. It's about early learning within children's, and it's in preventing people going into hospital and needing that care from the adult side. So I think this has been really useful and very, very reassuring for me. There are still a significant amount of risks. We could talk forever about the risks this year because they are huge. We've got COVID, we've got Brexit coming. We've almost got the perfect storm waiting to hit us next year. But I'd like to take this opportunity to thank all the officers who've done all the work on this budget. I think it has been an extremely well thought through, really measured, very thoughtful budget. And thankfully, I think that a comment from Jim McManus is, do we all want tissues because everything is being cut? I think no, I don't think I certainly do. Because although things are being cut and rearranged, they are being rearranged in a positive sort of way. So if there are no more questions. I think we'll go on to item 5 on the agenda, which is exempt business. There is no exempt.
Could I make a point, and Graham's also in the box? Graham's mentioned homelessness. I don't know if he wants to speak to it.
No, Chairman. I was just adding to the good prevention work that the officers are doing.
I'm sorry, I should have included homelessness as well, and the hidden homelessness.
And could I just say as well, one thing that I've picked up through this, and I need to be careful within the budget and not lose sight of it, is the hidden needs. When we've heard about, Maria's just talked about these neat young people, so many people, it can take quite a while before they come to us for some help and support. So by which time their needs could be very great. And also people in care that actually lose the ability to be funding themselves, and we might not have known about it. We might not have even known they were in care. And I think, again, when we're looking at these numbers and the cost of this, as a committee, as a scrutiny group, we should never lose sight of what's round the corner and what's coming fast along the tracks to us.
Thank you very much. Thank you very much, Councillor Rennie. You're absolutely spot on. I think I'd like to wind this meeting up now and thank everybody who...
Chairman, it's Helen.
Yes.
How is this item going to be taken forward?
Okay, what we intend to do is to take this forward to Cabinet. I've got copious notes of questions that have been asked, and we will provide basically a list of issues and questions that have been raised by the Scrutiny Committee, which will be taken forward for a Cabinet response to them.
Thank you.
Jill, can I just...
Yes.
And as well, I think you said you were going to be sending that list out to all of the members.
We will do. It should have come out ahead of the meeting, but it didn't. So I think what we'll do now is, if I work on it with Helen, and we'll send it out to members just to make sure we've captured everything that we had this morning, which will also include the members who are not on Scrutiny Committee. And with that, I think, unless anybody else has got anything to add, I'd like to close this meeting. But what I would like to do is just remind everybody that the Places and Resources Committee will start. I would suggest to Councillor Bartlett that if he could start in a couple of minutes, because I think everybody from here will possibly want to go to that meeting. Could I also remind people that you will need to come out of this meeting and go back into Teams to get into the forthcoming meeting. So I would suggest that Councillor Bartlett, if he's still there, if he would like to start his meeting, possibly at 20 to 12. Are you still there, Shane?
Yes, Madam Chairman, I'm happy to do that, 20 to 12.
Okay, thank you very much, and goodbye, everybody.